Hi everyone, I'm Professor Sun Myung from the NCC GCSP. This time, following the previous video, I'm going to talk about the remaining of the female reproductive system and also the endocrine system. Now, I'm going to talk about the diagnostic, symptomatic, and related terms of the chapter 12. Female reproductive system, adnexa, is the accessory part of a structure. Atresia is the congenital absence or closure of a normal body opening, such as the vagina. Choriocarcinoma is the malignant neoplasm of the uterus or at the site of an ectopic pregnancy. Corpus luteum is an ovarian scar tissue that results from rupturing of a follicle during ovulation and becomes a small yellow body that produces progesterone after ovulation. Contraceptive diaphragm is the contraceptive device consisting of a hemisphere of thin rubber bonded to a flexible ring. Dyspareunia is the occurrence of pain during sexual intercourse. Endocervicitis is the inflammation of the mucous lining of the cervix uteri. Fibrinosis is the benign uterine tumors composed of muscle and fibrous tissue. It is also called leiomyomas or uterine myoma. Infertility is the inability or diminished ability to produce offspring. Hormonal contraception or oral contraceptive pills. It is the use of hormones to suppress ovulation and prevent conception. Menarche is the beginning of menstrual function. Oligomenorrhea is the scanty or infrequent menstrual flow. Perineum is the region between the vulva and the anus that constitutes the pelvic floor. Puberty is the period during which secondary sex characteristics begin to develop and the capability of sexual reproduction is attained. Pyosalpinx is the pus in the fallopian tube. Retroversion is the turning or state of being turned back. Sterility is the inability of the female to become pregnant or the male to impregnate the female. Vaginismus is the painful spasm of the vagina from contraction of the muscles surrounding the vagina. Regarding the terms in the obstetrics, a ruptured placenta is the premature separation of a normally situated placenta. Abortion is the termination of pregnancy before the embryo or fetus is capable of surviving outside the uterus. Amnion is the membrane continuous with and covering the female side of the placenta. Breech presentation is the common abnormality of delivery in which the fetal buttocks or feet present rather than the head. Down syndrome trisomy 21 is the congenital condition characterized by physical malformations and some degree of mental retardation. Dystocia is difficult labor. Eclampsia is the most serious form of toxemia during pregnancy. Ectopic pregnancy is the pregnancy in which the fertilized ovum does not reach the uterine cavity but becomes implanted on any tissue other than the lining of the uterine cavity, such as a fallopian tube, an ovary, the abdomen, or even the cervix uteri. Gravida is the pregnant woman. Multigravida, the woman who has been pregnant more than once. Multipara is the woman who has delivered more than one viable infant. Para is the woman who has given birth to one or more viable infants. Parturition is the process of giving birth. Childbirth. Pelvimetry is the measurement of the pelvic dimensions. Placenta previa is the condition in which the placenta is attached near the cervix and ruptures prematurely. with spotting as the early symptom. Primigravida is the woman pregnant for the first time. Primipara is the woman who has given birth to one viable infant, her first child, indicated by the notation para, I, on the patient chart. Para, I, this one is 1. Puerperium is the period of 42 days after childbirth and expulsion of the placenta and membranes, during which the reproductive organs usually return to normal. This figure shows the ectopic pregnancy and the sites of ectopic pregnancy. Here, figure A, you can see the ectopic pregnancy. For example, you can see the this shows the ectopic pregnancy in the fallopian tube. So you can see the amnion, chorion, villi embedding tube wall, and also fetus. And the sites of ectopic pregnancy are shown in the figure B. For example, fimbria, lumen of the fallopian tube, interligamentous site, interstitial area, isthmic area, ampulla, abdominal, and cervical, and so on. And amniocentesis. Amnion means amnion, amniotic sac, and centesis is the surgical puncture. So amniocentesis is the transabdominal puncture of the amniotic sac under ultrasound guidance using a needle and syringe to remove amniotic fluid. This shows the procedure of amniocentesis. Using the ultrasound monitor, the obstetrician draw out the amniotic fluid by using the syringe, and we can conduct the DNA and chromosome analysis for the diagnosis of the congenital disease like Down syndrome. Insufflation is the delivery of pressurized air or gas into a cavity, chamber, or organ to allow visual examination, remove an obstruction, or apply medication. Colposcopy. Colpo means vagina. Scopy is the visual examination. So colposcopy is the visual examination of the vagina and cervix with an optical magnifying instrument. Colposcope. Laparoscopy is the visual examination of the abdominal cavity with a laparoscope through one or more small incisions in the abdominal wall, usually at the umbilicus. This figure shows the laparoscopic procedure. As you can see here, you can see the laparoscope. And chorionic villus sampling. This is the sampling of placental tissues for prenatal diagnosis of potential genetic defects. Endometrial biopsy is the removal of a sample of uterine endometrium for microscopic study. PAP test, Papa Nicolau test, is the cytological study used to detect abnormal cells slowed from the cervix and vagina, usually obtained during routine pelvic examination. Mammography, MAMM, is breast. So the mammography is the radiographic examination of the soft tissues of the breast. Hysterosalpingography is the radiography of the uterus and uterine tubes following injection of a contrast medium. Here, hystero means uterus. Salpingo means the fallopian tube. Ultrasonography. Transvaginal ultrasonography means this is the process by which high-frequency sound waves ultrasound produce and displays an image from reflected echoes on a monitor, also called ultrasound, sonography, and echo. And transvaginal means through the vagina. Cerclage is the procedure in which non-observable ligature is applied around the cervix uteri to treat incompetent uterus, thus decreasing the chance of a spontaneous abortion. Cesarean birth is an incision of the abdomen and uterus to remove the fetus. It is called C-section, cesarean section. Corpoclasis is the surgical closure of the vaginal canal. Conization is the excision of a cone-shaped piece of tissue, such as mucosa of the cervix, for histological examination. Codocentesis is the sampling of fetal blood drawn from the umbilical vein and performed under ultrasound guidance. Cryosurgery is the process of freezing tissue to destroy cells. DNC, dilation and curettage. This is the widening of the cervical canal with a dilator and scraping of the uterine endometrium with a curette. This is used to treat incomplete abortion. Episiotomy is the repair of a lacerated vulva or an episiotomy. Episiotomy is an incision of the perineum from the vaginal orifice, usually done to prevent tearing of the tissue and to facilitate childbirth. Hysterectomy is the excision of the uterus. There are several types: subtotal hysterectomy, total hysterectomy, total plus bilateral salpingo-oophorectomy. This figure shows hysterectomy. The upper one shows the subtotal hysterectomy. So the cervix is not removed. Here, the removed parts are purple, just uterus. But in the left side, you can see the total hysterectomy. This includes the removal of cervix. And also the last one is the total hysterectomy plus bilateral salpingo-oophorectomy. This means remove the both sides, fallopian tube and ovary, including uterus. Intrauterine device, IUD, is the plastic or metal object placed inside the uterus to prevent implantation of a fertilized egg in the uterine lining. Lumpectomy is the excision of a small primary breast tumor that leaves the remainder of the breast intact. Mammoplasty or mastoplasty is the surgical reconstruction of the breast, sometimes augmented by substances such as fat tissue or silicone to alter size and shape. Mastectomy is the excision of the breast. Radical mastectomy is the removal of the breast and any involved skin, pectoral muscles, axillary lymph nodes, and subcutaneous fat. Myomectomy is the excision of a myomatous tumor, generally the uterine myoma. Salpingo-oophorectomy is the excision of an ovary and fallopian tube. Tubal ligation is the procedure that ties or ligates the uterine tubes to prevent pregnancy. Pharmacology: antifungals, estrogens, oral contraceptives, oxytocics. Oral contraceptives prevent pregnancy. Prostaglandins terminate pregnancy. Abbreviations: AB, abortion; AI, artificial insemination; BSE, breast self-examination; DNC, dilatation and curettage, or dilation and curettage; DUB, dysfunctional uterine bleeding; FSH, follicle stimulating hormone; G, gravida or pregnant; GC, gonorrhea; GYN, gynecology; HRT, hormone replacement therapy; HSG, hysterosalpingography; HSV, herpes simplex virus; IUD, intrauterine device; LH, luteinizing hormone. LMP, last menstrual period. LSO, left salpingo-oophorectomy. OCPS, oral contraceptive pills. PAP, Papa Nicolau smear, Pap smear. PID, pelvic inflammatory disease. PMP, previous menstrual period. PMS, premenstrual syndrome. RSO, right salpingo-oophorectomy. STD, sexually transmitted disease. TAH, total abdominal hysterectomy. TVH, total vaginal hysterectomy. VD, venereal disease. CPD, cephalopelvic disproportion. CS, or C-section, cesarean section. CVS, chorionic villus sampling. CWP, childbirth without pain. FECG, fetal electrocardiogram. FHL, fetal heart rate. FHT, fetal heart tone. FTND, full-term normal delivery. IUGR, intrauterine growth rate or intrauterine growth retardation. IVF-ET, in vitro fertilization and embryo transfer. LBW, low birth weight. MB, newborn. OB, obstetrics. Para 1 to 3. Unipara, bipara, tripara, number of viable births. UC, uterine contractions. Now, I'm going to talk about the last chapter of this medical terminology 4, chapter 13, endocrine system. Key terms: diabetes insipidus. This is the disorder of insufficient secretion of antidiuretic hormone ADH by the posterior portion of the pituitary gland. Diabetes mellitus. This is a chronic metabolic disorder of impaired carbohydrate, protein, and fat metabolism due to insufficient secretion of insulin or insulin resistance of target tissues. Electrolyte, mineral salts, sodium, potassium, and calcium that carry an electrical charge in solution. Glucagon is a hormone produced by pancreatic alpha cells that increases the blood glucose levels by stimulating the liver to change stored glycogen. Glucose is the simple sugar that is the end product of carbohydrate digestion. Homeostasis, hormone. Hormone is the chemical substance produced by specialized cells of the body that are released slowly in minute amounts directly into the bloodstream. Hypoglycemia, greater than normal amount of glucose in the blood. Idiopathic means pertaining to conditions without clear pathogenesis. Insulin is the hormone produced by pancreatic beta cells that acts to clear sugar from the blood by promoting its storage in tissues as carbohydrate. Mimetic means imitation or stimulation of a certain effect. Sympathomimetic is the agent that mimics the effects of the sympathetic nervous system. Target is a structure, organ, or tissue to which something is directed. Anatomy and physiology. The endocrine system comprises a network of ductless glands that produce specific effects on body functions by slowly discharging hormones directly into the bloodstream. On the contrary, the exocrine glands are the sweat and oil glands of the skin, which release their secretions externally through ducts. The target organ or tissue is the organ or tissue that respond to the effects of a hormone. The release of a hormone by an endocrine gland to a target organ is determined by the body's need for the hormone at any given time and is regulated to avoid overproduction, hypersecretion, or underproduction, hyposecretion. This chapter discusses the structure, hormones, and functions of the pituitary, thyroid, parathyroid, adrenal, pancreatic, and pineal glands. The function of the thymus is covered in chapter 9, the testes in chapter 11, and the ovaries in chapter 12. First, the pituitary gland. The pituitary gland, also known as hypophysis, is no larger than a pea, and it is located at the base of the brain. It is also known as the master gland because it regulates many body activities and stimulates other glands to secrete their own specific hormones triggered by the action of the hypothalamus. There are two distinct portions, the anterior lobe and the posterior lobe. The anterior lobe is the adenohypophysis. It produces at least 6 hormones. Remember these hormones, 6 hormones: ACTH, FSH, GH, LH, prolactin, and TSH. And from the posterior lobe, which is called the neurohypophysis, 2 hormones are produced, ADH and oxytocin. This figure shows the locations of major exocrine glands. Number 1 shows the pituitary gland hypophysis. In the anterior lobe, ACTH, FSH, GH, LH, prolactin, and TH. And in the posterior, there are ADH and oxytocin. Pineal gland secretes melatonin. And you can see the parathyroid glands in the area of the thyroid glands. It produces PTH, parathyroid hormone, and the thyroid gland secretes thyroid hormones like T4, T3, and also calcitonin. And on the chest, you can see the thymus gland, and the adrenal glands are located in the kidneys. And in the adrenal gland cortex, the cortisol, aldosterone, and sex hormones are released. And in the medulla, epinephrine and norepinephrine are secreted. And in the pancreas, glucagon and the insulin are released. And the ovaries release the estrogen, progesterone, and inhibin. And lastly, the testes release the testosterone and inhibin. This figure shows the hormones secreted by anterior and posterior pituitary gland along with target organs. So again, in the anterior pituitary part, there are 6 hormones. For example, ACTH, GH, TSH, FSH, LH, prolactin. And in the posterior pituitary, ADH and oxytocin are released. In the posterior pituitary hormones, there are 2 hormones, ADH, antidiuretic hormone, and the oxytocin. This ADH targets the kidney, so increases water reabsorption. Water returns to the blood. And the oxytocin stimulates the uterus and the uterine contractions. And to the breast, the oxytocin promotes milk secretion from the mammary glands. And also in the anterior pituitary hormones, there are 6 ones. ACTH, adrenocorticotropic hormones from the adrenal cortex. FSH, follicle stimulating hormone. And LH, luteinizing hormone. These are female sex hormone. And growth hormone, GH, and prolactin, and TSH, thyroid stimulating hormone. First, thyroid gland is the largest gland of the endocrine system. This is an H-shaped organ located in the neck just below the larynx. The thyroid gland is composed of 2 large lobes that are separated by a strip of tissue called an isthmus. The thyroid hormone is the body's major metabolic hormone, which increases the rate of oxygen consumption and thus the rate at which carbohydrates, proteins, and fats are metabolized. There are 2 active iodine-containing hormones, thyroxine, T4, and the triiodothyronine, T3. T4 is the major hormone secreted by the thyroid, and the Most T3 is formed at the target tissues by conversion of T4 to T3. This affects virtually every cell in the body. This also influences growth hormone and plays an important role in maintaining blood pressure. And also there is calcitonin. The calcitonin regulates calcium levels in the blood in conjunction with parathyroid hormones in the thyroid. Parathyroid gland the parathyroid gland consists of at least 4 separate glands located on the posterior surface of the lobes of the thyroid gland. The parathyroid hormone, PTH, is the only hormone secreted by the parathyroid glands. PTH helps to regulate calcium balance by stimulating 3 target organs: bones, kidneys, and intestines. Here you can see the parathyroid hormones, target organ and functions. The PTH increases the reabsorption of calcium in the bone, and in kidney it increases calcium absorption and phosphate excretion, and also in the small intestine it increases absorption of calcium and phosphate. The adrenal glands are paired organs covering the superior surface of the kidneys, also known as suprarenal glands. There are 2 sections in the adrenal glands: the adrenal cortex and the adrenal medulla. The adrenal cortex makes up the bulk of the gland in the outer portion, and the adrenal medulla makes up the inner portion. Although these regions are not sharply divided, they represent distinct glands that secrete different hormones. The adrenal glands secrete 3 types of steroid hormones: mineralocorticoid, glucocorticoid, and sex hormones. The glucocorticoids mainly they are cortisol. They influence the metabolism of carbohydrates, fats, and proteins. And the cortisol helps to regulate the concentration of glucose in the blood, protecting against low blood sugar levels between meals. Also stimulates the breakdown of fats in adipose tissue. And sex hormones, there are androgens, estrogens, and progestins. They help maintain secondary sex characteristics. The adrenal medulla secrete 2 closely related hormones, epinephrine and norepinephrine. They are considered the sympathomimetic agents because they produce effects that mimic those brought about by the sympathetic nervous system. Epinephrine is secreted in large amounts. The norepinephrine reduces the diameter of blood vessels in the periphery. It is called vasoconstriction, so thereby raise the blood pressure. This figure shows the physical manifestations of Cushing's syndrome. This Cushing's syndrome is caused by excessive ingestion of steroid, glucocorticoid steroid. Here you can see the thinning hair, moon face, increased body and facial hair, buffalo hump, supraclavicular fat pad, purple stria, slow wound healing, thin extremities, and easy bruising. Pancreas lies inferior to the stomach in a band of the duodenum. The functions of the pancreas, they function as both as an exocrine and endocrine gland. Exocrine portions, a large pancreatic duct runs through the gland, carrying enzymes and other exocrine digestive secretions from the pancreas to the small intestine. As for the endocrine portion, it consists of groups of cells called islets of Langerhans that produce 2 distinct types of hormones: alpha cells that produce glucagon and beta cells beta cells that produce insulin. Both hormones play important roles in the proper metabolism of sugars and starches in the body. Insulin and glucagon function as opposites. Normal secretion of both hormones ensures a blood glucose level that fluctuates within normal limits. When blood glucose levels are low, hypoglycemia, glucagon stimulates the release of glucose from storage sites in the liver because the liver converts stored glycogen to glucose, which is called glycogenolysis. The blood glucose levels rises. When blood glucose levels are high, hypoglycemia, the pancreatic beta cells are stimulated to produce insulin, which causes glucose to enter body cells to be used for energy and acts to clear glucose from the blood by promoting its storage as glycogen. So you have to remember two important hormones, glucagon and insulin, from the pancreas. And the pineal gland, it is shaped like a pine cone attached to the posterior part of the third ventricle of the brain. Although the exact functions of this gland have not been established, there is evidence that it secretes the hormone melatonin. The melatonin may inhibit the activities of the ovaries. When melatonin production is high, ovulation is blocked, and there may be a delay in puberty development. And melatonin also affects the modulation of sleep patterns in both seasonal and circadian rhythms. Medical word elements: adrenal means adrenal glands. Calc means calcium. Hypercalcemia is the abnormally high level of calcium in the blood. Crin means secret. So endocrinology is the study of the endocrine glands and their functions. Glucose, glyc, all mean sugar. Home means same, homeostasis. Kali means potassium. Pancreatum, parathyroid, thymus, thyroid. Toxic means poison. Crin means secret. Endocrine means secret internally or within. Dipsia means thirst. So polydipsia is the excessive thirst. Gen means foaming. Toxic, poison. Urea means urine. U means normal. Euthyroid means pertains to a normal thyroid gland. Exo means outside. Hyper, excessive. Hypo, under, below. Poly means many. Polyuria is the excessive secretion and discharge of urine. Pathology. There are several disorders of the endocrine system. Underproduction, which is hyposecretion, and overproduction is hypersecretion of hormones. Pituitary disorders, hypersecretion or hyposecretion of growth hormone leads to body size abnormalities. Abnormal variations of ADH secretion lead to disorders in the composition of blood and marked electrolyte imbalance. Thyroid disorders, they are very common and may develop at any time during life. Cretinism is one form of hypothyroidism that develops in infants. If not treated, it leads to mental retardation, impaired growth, low body temperatures, and abnormal bone formation. Hypothyroidism during adulthood, its severe form is also known as mixed edema. The characteristics of this disease include edema, low blood levels of T3 and T4, mental retardation, weight gain, and sluggishness. On the contrary, hyperthyroidism results from excessive secretions of thyroid hormones, T3, T4, or both. The most common hypothyroidism are Graves' disease and toxic goiter. Graves' disease is considerably more prevalent and is characterized by an elevated metabolic rate, abnormal weight loss, excessive perspiration, muscular weakness, and emotional instability. And also, the eyes are likely to protrude, which is called exophthalmos, because of edematous swelling in the tissues behind them. At the same time, the thyroid gland is likely to enlarge, producing goiter. This shows the enlargement of the thyroid gland in goiter. You can see the goiter, swelling of the neck. Toxic goiter may occur because of excessive release of thyroid-stimulating hormone, TSH, from the anterior lobe of the pituitary gland. Overstimulation by TSH causes thyroid cells to enlarge and secrete extra amounts of hormones. The treatment involves drug therapy to block the production of thyroid hormones or surgical removal of all or part of the thyroid gland. And also, we can administer a sufficient amount of radioactive iodine to destroy the thyroid secretory cells. Hypoparathyroidism is the insufficient production of parathyroid hormone. This can be caused by primary parathyroid dysfunction or by elevated blood calcium levels. This can result from an injury or from surgical removal of the glands, sometimes in conjunction with thyroid surgery. The main symptom or sign is the decreased blood calcium level, which is hypocalcemia, and it can result in muscle twitchiness and spasms, which is called tetany. Also, hyperparathyroidism is the excessive production of PTH, commonly caused by a benign tumor. It can lead to demineralization of bones and making them porous, osteoporosis, and highly susceptible to fracture and deformity. And also, there are disorders of the adrenal glands. In the adrenal cortex, Addison disease and Cushing syndrome are the representative ones. Addison disease is a relatively uncommon chronic disorder caused by a deficiency of cortical hormones, results when the adrenal cortex is damaged or atrophied. Clinical manifestations: the gland usually suffers 90% destruction before clinical signs of adrenal insufficiency appear. Interferes with the body's ability to handle internal and external stress, so muscular weakness, anorexia, GI symptoms, fatigue, hypoglycemia, hypotension, low blood sodium, hyponatremia, high serum potassium, hypokalemia, or severe chronic dehydration. Cushing syndrome is a cluster of symptoms caused by excessive amounts of cortisol, adrenocorticotropin hormone (HTH), or both circulating in the blood. Causes are long-term administration of steroid drugs, adrenal tumor, and Cushing disease. Cushing disease is a pituitary disorder that results in increased secretion of HTH. Regardless of the cause, it alters carbohydrate and protein metabolism and electrolyte balance. And sodium retention causes increased fluid in tissue that leads to edema, weight gain, and structural changes, such as a moon-shaped face, grossly exaggerated head and trunk, and penciled thin arms and legs. You saw the figure previously. In the adrenal medulla, no specific diseases can be traced directly to a deficiency of hormones from the adrenal medulla. Medullary tumors sometimes cause excess secretions. Pheochromocytoma produces excessive amounts of epinephrine and norepinephrine, encapsulated and usually benign. Treatment is the antihypertensive drug and the surgery. Pancreatic disorders. Diabetes is a term that, when used alone, refers to diabetes mellitus. It is very, very common disease, DM, diabetes mellitus. This is a disease in which the body does not produce sufficient insulin or does not utilize it properly. So the insulin is an essential hormone for conversion of sugar, starches, and other food into energy required for daily life. And in patients with diabetes, the glucose is excreted in the urine, which is called glycosuria, along with electrolytes, particularly sodium. Polyphagia, because glucose cannot enter the cells, cellular starvation results and leads to hunger and an increased appetite. There are two primary forms in DM, type 1 and type 2 diabetes. Type 1, aka insulin-dependent diabetes mellitus, IDDM, is usually diagnosed in children and young adults, and it was previously called juvenile diabetes. The body does not produce insulin, so the treatment is the injection of insulin. But type 2 diabetes, aka non-insulin dependent diabetes mellitus, NIDDM, this is the most common form and it is distinctively different from type 1. It usually later in life develops, and risk factors include a family history of diabetes and obesity. The body is deficient in producing enough insulin, or the body's cells are resistant to insulin action in target tissues. So the hypoglycemia may cause cell starvation and over time may damage the kidneys, eyes, nerves, and heart. The treatment includes exercise, diet, weight loss, and if needed, insulin or oral anti-diabetic agents. This shows the clinical manifestations of two different diabetes, type 1 and type 2. And primary and secondary complications. Patients with type 1 diabetes usually report rapidly developing symptoms. With type 2 diabetes, the patient's symptoms are usually vague, long-standing, and develop gradually. Primary complications of type 1 diabetes one of the complications is DKA, diabetic ketoacidosis, which is also referred to as diabetic acidosis or diabetic coma. It may develop over several days or weeks. It can be caused by too little insulin, failure to follow a prescribed diet, physical or emotional stress, or undiagnosed diabetes, diabetic ketoacidosis. And secondary complications due to long-standing diabetes emerge years after the initial diagnosis. They are diabetic retinopathy and diabetic nephropathy. Pancreatic cancer. Most carcinomas of the pancreas arise as epithelial tumors, adenocarcinomas, and make their presence known by obstruction and local invasion. Because the pancreas is richly supplied with nerves, pain is a prominent feature of pancreatic cancer. Etiology is unknown, but cigarette smoking, exposure to occupational chemicals, a diet high in fats, and heavy coffee intake are associated with an increased incidence of pancreatic cancer. The prognosis is very poor. Pituitary tumors are generally not malignant. However, because their growth is invasive, it is considered neoplastic and are usually treated as such. Initial signs and symptoms are headache, blurred vision, and commonly personality changes, dementia, and seizures. The treatment depends on the size of the tumor and its location. The treatment includes surgical removal, radiation, or both. Thyroid cancer carcinoma is classified according to the specific tissue that is affected. When the tumor is large, it typically destroys thyroid tissue, which results in symptoms of hypothyroidism, but sometimes it stimulates the production of thyroid hormone, resulting in symptoms of hyperthyroidism. And treatments include surgical removal, radiation, or both. As for diagnostic, symptomatic, and related terms, acromegaly, acro means extremity, megaly means enlargement. This is the chronic metabolic disorder characterized by a gradual, marked enlargement and thickening of the bones of the face and jaw. Diuresis is the abnormal secretion of large amounts of urine. Glucagon is a hormone secreted by the pancreatic alpha cells. Glucose. Glycosuria is the presence of glucose in the urine. Graves' disease. This is the multisystem autoimmune disorder characterized by pronounced hyperthyroidism, usually associated with enlarged thyroid gland and exophthalmos. Hirsutism is the excessive distribution of body hair, especially in women. Hypercalcemia is the excessive amount of calcium in the blood. Hypokalemia is the excessive amount of potassium in the blood. Hypervolemia is the abnormal increase in the volume of circulating fluid in the body. Hyponatremia is the abnormal condition of low sodium in the blood. Insulinoma is the tumor of the islets of Langerhans of the pancreas. Obesity is the abnormal increase in the proportion of fat cells, mainly in the viscera and the subcutaneous tissues of the body. Panhypopituitarism. Pan means all, so total pituitary impairment that brings about a progressive and general loss of hormonal activity. Pheochromocytoma is the small chromaffin cell tumor. Thyroid storm is the crisis of uncontrolled hyperthyroidism caused by the release into the bloodstream of increased amount of thyroid hormone. Virile is the masculine or having characteristics of a man. Virilism, masculinization in a woman or development of a male, secondary sex characteristics in the woman. Diagnostic and therapeutic procedures. Exophthalmometry This is a test that measures the degree of forward displacement of the eyeball, exophthalmos, as in Graves' disease. FBG, fasting blood glucose. This is a test that measures blood glucose level after a 12-hour fast. GTT, glucose tolerance test. This is a test that measures the body's ability to metabolize carbohydrates by administering a standard dose of glucose and measuring glucose level in blood and urine at regular intervals. Insulin tolerance test. This is the test that determines insulin levels in serum by administering insulin and measuring blood glucose level in blood at regular intervals. Thyroid function test, TFT. This is the test that determines increase or decrease in thyroid function. CT, MRI, RAIU, radioactive iodine uptake. This is administration of radioactive iodine, RAI, orally as a tracer to test how quickly the thyroid gland takes up iodine from the blood. Thyroid scan. Microneurosurgery of pituitary gland, parathyroidectomy, pinealectomy, thymectomy. Thyroidectomy is the excision of the thyroid gland. Pharmacology. There are several drugs used to treat endocrine disorders, insulins, oral antidiabetics, antithyroids, corticosteroids, growth hormone replacements, thyroid supplements. Abbreviations: ACTH, adrenocorticotropic hormone, ADH, antidiuretic hormone, which is also called vasopressin. BMR, basal metabolic rate. DIA, diabetes insipidus. DKA, diabetic ketoacidosis. DM, diabetes mellitus. FSH, follicle stimulating hormone. GH, growth hormone. IDDM, insulin dependent diabetes mellitus. K, potassium. LH, luteinizing hormone. MSH, melanocyte stimulating hormone. NIDDM, non-insulin dependent diabetes mellitus. NPH, neutral protamine hagedon insulin. This is one type of the insulins. MPH, PLL, prolactin, PGH, pituitary growth hormone, PTH, parathyroid hormone, RAI, radioactive iodine, RAIU, radioactive iodine uptake, T3, T4, TFT, thyroid function test, TSH, thyroid stimulating hormone. Okay, that's it. So, see you next.